Hi everyone, welcome back to my channel. It's the aftermath of my toothache ordeal, and I need to apologize. I really don't know what happened to me on that video. I don't know. It wasn't like I was in pain or anything, but I just noticed that my volume was really low. It happens sometimes. That kind of thing. So there are some information I even missed in that ordeal that I was talking about, and some of the information was the fact that as soon as that amalgam, but by the way, I heard that amalgam, it's even an old feeling and it has been outdated, it has been phased out because they said there are traces of the fact that it could cause cancer or radiation. I don't know, because it's metal. So is an outdated feeling, because I told you earlier I did that feeling more than 10 years ago or so. So definitely currently, because as soon as I even went to the first dentist, they were like, wow. Even the second dentist, they were like, wow, this was long ago. I said yes. And so after the extraction of the tooth, I was now given antibiotics, obviously, for people that have extracted tooth before. That is how it is. You'll be given antibiotic, and then you'll be given a little instruction on a paper, and that is the instruction is that you gargle your mouth with warm water and salt every, I think it took me every 1 hour or so. Then on the day that the tooth was extracted, I wasn't allowed to eat, although it was kind of a routine that I was kind of used to, because after removing almost how many teeth. But then it's just still something that you need to follow up with. It's very important because the salt helps to kill bacteria, because at that moment when the tooth is extracted, that place is open now, the cavity there, the tooth has been extracted, so it's open, so it's very prone to infection. So at that moment, at least the first 3 days, you should take it very seriously. So after that, obviously I came, but I experienced some pains down here like normal. And pulling. See, if you don't have mind, or if you hate needles, when you see the needle of the very big, it's not the normal needle that they inject you on in the hospital. That's the dentist needle. It's kind of extra large, and when you see it, if you're the type that is scared of needles. In fact, I didn't even say this quickly. Now, when I got to the dentist's office, though I didn't have abscess where my face got swollen, I didn't get to that point. But I remember there was a year that I had that issue. It got to that point, I had serious abscess. The face was obviously swollen, but this time around I didn't have abscess despite all the pains and all that. So when I got talking, because going into the dentist's office, there was AC on. God, for anyone that has had toothache before knows that AC and toothache, it doesn't work together. They don't tally together at all. So when I was talking, the guy noticed that I was in pain. He was like, okay, then just give me some shots to calm down, like numbness, you understand now, basically to numb the place so I don't feel pain. But I was able to tell him what exactly was my problem. So basically, the aftermath of the toothache was okay. It's almost like the bonding was taken away from me, and I was totally fine. Totally fine. After like a week or two, I almost forgot that I had this extraction. And then there was something very important too that they told me that day I shouldn't suck on it, so that I don't want to go there. So thank you so much. This video, I just like to make it very short. It's the aftermath, and to also apologize that the volume of that other video was so low. Forgive me, I beg. I know you have to listen to it maybe wearing earphones or earpods, or I'm sorry. I hope this one is loud enough. So thank you so much, and hope to see you in another video. Bye.